Welcome back to Beyond the Crime, the podcast that takes you into the minds of criminals with your hosts Dr. Lars Madsen, Shay Addison, and Dr. Rob Brockman.
Welcome back, everyone, to Beyond the Crime, the psychological analysis podcast where we dive into all things forensic schemery. And today, I'm very fortunate to be able to have my colleague and friend, Professor Kate Fritzon from Bond University, who's going to be here today to talk to me about her research and experience and expertise in fire setting. Welcome, Kate. We're really pleased. You're actually our first guest on the podcast, which has been around for about a year now, I think.
Oh, I didn't realize that. That's exciting.
Yes, well, yes. Well, welcome.
Thank you. Thanks, Lars. Lovely to be here.
And we're going to be talking about obviously fire setting, which is where your area of expertise is in, and the research that you've done. So maybe, Kate, you can perhaps tell us a little bit about yourself in terms of how you became interested in the psychology of fire setting, and a little bit about your background, because I know that you studied at Liverpool Uni.
That's right. I started my forensic psychology career at the University of Surrey, actually, which was where Professor David Cantor was originally. Yes. And then after my master's, he moved up to Liverpool, and he took a few of us with him. We all went up. We moved with him to do our PhDs, and that's where I did my PhD at the University of Liverpool in the UK.
In the UK, yeah. So yeah. David Cantor was your
David Cantor was my supervisor. Yeah. It was a very interesting time in forensic psychology. Lots of focus on profiling, or at least I guess that was the world I was in. There was always the kind of forensic clinical side as well, but different folk specializing in that area.
I remember. And he wrote a book called, was it Dark Shadows or something like that?
Criminal Shadows, yeah.
Criminal Shadows, yes. I remember reading that when I was in the UK there as well.
Did you? Yeah.
And wow, okay. That's fascinating. Yeah. Right. So what got you interested in fire setting?
So honestly, it was at least partly because there really just hadn't been that much research done on fire setting at the time when I was doing my PhD, which I started in 1994. And at the time, the world of research, the world of forensic research in particular, was so different to how it is these days, because these days it's quite difficult to do research with, real world data and getting access to, police crime files and things like that. I can't really imagine that would be very easy to do at all anymore. But at the time, because David Cantor had all these contacts with the police, a few of us were able to get access to police data. So I had to sign the Official Secrets Act at the Metropolitan Police. And then I was basically allowed to go into this archive room and actually look up cases of people who had been convicted of setting fires. And so I did that. So I was sitting there in this dark, dingy dungeon at the Metropolitan Police, having signed the Official Secrets Act to say I wouldn't ever tell anyone. I wouldn't ever tell anyone. I don't think it said that I couldn't tell anyone that they came from the Metropolitan Police.
Well, you published the research, so it's
published,
out there.
And it's, yeah. So I got access to these police files. And as I said, there wasn't anyone else doing that kind of research at the time, particularly on arson. And then also I did just think, well, what an psychologically interesting thing to do, when you're angry with someone, or you're angry with the world, or you're feeling very, very distressed. There's so many different things you could do. But fire is such a kind of palpably destructive thing to do. So I find that interesting.
Wow. I mean, that's a fascinating story. That's a great story. So I guess for our listeners who may not be familiar, how would you define fire setting from a psychological perspective? Now, fire setting we're talking about is also arson, right? Or are they different terms?
Yeah, that's a good question because they are different terms. And so arson is technically a legal term. So that's what you would be charged with. If you were charged with setting a criminal fire, then you would be charged with arson. You could be charged with criminal damage by fire either, but arson is the official criminal term, whereas fire setting is just a description of a behavior. So when we're talking about, or I guess the focus of my research is deliberate and malicious fire setting. So it's not people doing, rubbish burn-offs, which of course is quite common in Australia. And it's also not accidental fires where, maybe a campfire that someone hasn't extinguished properly and it ends up getting out of hand and could turn into something quite big like a bushfire. But it wasn't done maliciously, so that wouldn't be included in my kind of research.
So your definition for fire setting would be a deliberate attempt
malicious
to light fires for a purpose, to destroy something or to just create a large fire.
Yeah.
Right, okay. Are there different types of classifications of fire setters?
Yeah. So my research identified 4 subgroups. Other research has also looked at different classifications, but my ones were really to do with where did the motive, if you like, for setting the fire, where did it come from? And also what was the target for the fire? And what I mean by that, quite a simple or a simplistic distinction, was the motive. Did it come from something internal to the person? Was it, some kind of emotional reaction? Or did it come from something external to the person? So did something happen in the world or happen in a relationship or something that set them off? So that's the motive, internal or external. And then the target for the fire setting could also be internal or external. And when I say internal, I do literally include people who have, set fire to themselves, self-immolation, or, setting fire in their own home. So they're not really trying to harm anyone else. It's just very much kind of concentrated on themselves, or obviously
themselves or to them.
Well, both. So in my sample, there were people who they were all people with criminal convictions. So they hadn't obviously died, but there were people who had literally poured petrol on themselves or started like setting fire to their clothes. Okay. While they were wearing their clothes. I think there were about 8 of those cases where it was very much directed at themselves. And then there were another, I can't remember how many more, but where it was just in their own home. So they would kind of pile up some clothes, or often on beds. It would sort of be something it seemed like a very emotional act.
Wow. Okay, so when we talk about the trigger inside themselves, what would be the types of triggers that you identified in your research that would trigger this kind of? And what do you call it? Do you call it a coping response, or do you call it that would be the motivation?
That's right. So you could talk about again that kind of internal driver tended to be of 2 types. So one was where it was really about the fire. It was about wanting to create fire, and preferably quite big fires, and kind of have a dramatic effect. And then the other one was just very much emotional, like a cry for help.
Okay.
So driven by some kind of, mental health difficulties.
So one motivation was to make it as big as possible to cause harm and destruction.
Yeah.
And the other one was like I need help, or
I need help.
I want attention. I'm not coping, kind of.
Yeah. And so the difference there is the person who wants to create the big fire, whilst the source is internal, so the idea for the fire is internal. It's like, I love fire. The target is external. So they're going to set a big fire. It's going to be, maybe a business or a hospital or something big. So internal source, external target, whereas the cry for help is internal source and internal target.
Wow, okay. I forgot to ask, what was your research, your PhD called? Like, what was the specific title? I mean, obviously looking
Oh,
at
that's taking me back. You'd think that I would remember. I think it was called Differentiating Arson, colon a psychological something of deliberate fire setting.
okay.
Psychological classification of deliberate fire setting. I think that was the title. Yeah.
And you said you identified 4 types.
Yeah.
Is that right? Okay. So what are those types?
So the 2 that we just mentioned, so the internal source, external target. So I love fire, big fires. Internal source, internal target, cry for help. Then you've got external source, internal target. So external source usually meaning a partner or an ex-partner, someone's done something that's annoyed me. I'm angry or I'm distressed. And if I set fire to that person or their belongings or their house, I'm going to feel better. So it's changing something about my internal state. And then you've got external source and external target. And they tended to be kind of generally antisocial vandals, set fire to cars, set fire to businesses, maybe breaking in to steal something and then setting a fire to cover up the evidence.
Right. So it's more, the final one is more fire setting sits within a context of broader antisocial behavior.
Yes. Yeah.
So this is the fascinating bit. So you're looking at the characteristics of these different fire setters in your research. And I suppose that you've probably done more research. Well, I know you have, obviously, but are there common psychological traits or problems or disorders that are associated with fire setters that are unique to them, perhaps?
Well, I'll kind of talk a little bit outside of my own research here because other researchers have really looked into this a lot more than I have, because I wasn't really focusing on kind of clinical aspects initially. But people like Troy McEwen have done research on this more recently. And there do seem to be certain sorts of psychological disorders that are more associated with fire setting. For example, certain forms of psychosis seem to be more prevalent than in other types of criminals, and also some personality disorders. But also kind of a combination of things like substance use problems, plus other mental health problems. So, and when we're talking about juvenile fire setting, things like impulse control, conditions that affect somebody's ability to control their impulses, are also quite prevalent. So things like ADHD and conduct disorder, particularly for younger people. So I did find, so that research also supports my findings, or my findings support that research. It's just that I didn't have access to actual diagnostic information at the time. But I certainly found that, some of my subtypes or subgroups of perpetrators were more kind of generally antisocial. They might have conduct disorder. Others had what appeared to be much more severe mental health problems, including psychosis. The cry for help subtype was obviously that group. And then, a few with what appeared to be just kind of personality difficulties. There's a sort of classic profile of particularly serial arsonists, where they tend to be quite, not necessarily antisocial, but kind of asocial. They tend to be quite lonely, not really have very many friends, not be very socially skilled, and perhaps a bit odd in terms of their personality and their way of relating to people. And it's hard to really know why those people do become interested in fire setting, but it may be that for someone who's quite ineffective in their kind of social world and in their communication style, that, something like a fire, a big dramatic fire, a bushfire, which gathers a lot of attention, is maybe one of the only ways that people can feel that sense of power and look at me kind of thing.
Wow. Okay. Yeah. How much of a problem is fire setting in our communities? Like, is it? Here in Australia, we have bushfire season, and every season there seems to be anxiety, and certainly someone's been pinpointed for fire setting in this kind of. But I'm wondering, like, how common is it as a problem for the criminal justice system?
Well, it depends how you look at it. So it represents probably less than 10% of all crime.
Okay.
So not a huge problem, but also not nothing.
Right? I mean, it's serious, right? Like a serious fire is can be very, very harmful, right?
Yeah. And then in terms of bushfires in particular, it's a little bit hard to estimate precisely because often it's hard to get evidence of why a particular bushfire. And then, you might have a bushfire that starts over here and ends up over here and things join together. But again, some estimates have said up to 30% of bushfires are caused by human deliberate, acts. So
that's 30% in Australia?
Yeah, in Australia, yeah. And it could even be more because there's always a percentage, also roughly around 30% of bushfires where the cause is unknown. So, if we assume that some of those were also caused by humans, then it's more than 30%.
Mm-hmm. Deliberately caused by humans, right, as opposed to accidentally. Wow.
Well, sorry, thanks for clarifying. Yeah, so 30% are known to be caused by humans, but not necessarily deliberately. So that could be campfires that have, just gotten out of hand. And then up to another 30% could have been caused by humans that we just don't know. Yeah.
We touched on this before, talking a little bit about the characteristics of the typical firesetter. I mean, obviously, it's very difficult to pin down, but are there particular kinds of developmental factors or characteristics that might contribute to fire-setting behaviour in children and adolescents?
Yeah, so one of my PhD students, Danielle Perks, who did her PhD on the psychology of juvenile fire-setters.
Okay.
She actually found that she interviewed a group of juveniles who were incarcerated for having set fires, and she also compared them to another group and found that the ones who were convicted of setting fires had a particular profile of problems, and it was things like being more antisocial and having kind of more family problems. Okay. So often these kids have been removed from their family of origins. They had, poor educational achievements. They just had kind of like thing after thing that had sort of gone wrong for them. And again, that kind of ADHD profile or sort of impulse control difficulties was also associated with the fire setters in particular.
So was her research sort of showing that early experiences and perhaps factors were relevant for perhaps why they turned to fire setting? Get to that?
Yeah, I think that's that would be the conclusion, that given that they had a bigger set of problems and more intense problems, if you like, across family, school, community, mental health, than. And remember, the comparison group are still kids who are in trouble with the law. So they're not, kind of well-functioning, high-functioning kids. They're still kids with problems. But the ones who are setting fires seem to just have more problems. So it does seem that, perhaps early intervention and kind of identifying these kids that are struggling early on would probably go a long way to potentially preventing some fire setting. Yeah.
I'm thinking that just back on my career working within forensic institutions and in the community, I'm thinking that, to be honest, I can count on maybe one hand numbers I've had specifically for fire setting.
Right.
That, if we're having a percentage of around 10%, I find it fascinating that I haven't actually had more referrals or seen folks in the forensic clinical context for fire settings.
I guess, they probably, well, I don't know, maybe they don't end up in prison.
Yeah, okay.
They get more community orders. I agree with you. It is a bit of an odd thing that we don't seem to see as many of them.
Is that
In
your
those.
experience as well? Like in your experience? Well, I mean, obviously you're an expert in fire setting.
Well, I
Correct?
suppose my career in terms of doing forensic clinical work started in Broadmoor Hospital in the UK. So, funnily enough, there was quite a high percentage of people in there who had set fires. I say high percentage, but relative to prison. But I do wonder if that, they are in prison, but they're perhaps just not attending programs, or they're not being referred for psychological intervention. So that might be why you haven't come across them. But again, another colleague from the UK, Teresa Gannon, she did a study on developing a specific treatment program for people who had set fires. And she delivered that in the UK in a number of prisons. So there obviously were people, to deliver that program too.
Yeah.
Yeah.
Are there particular ways of assessing and diagnosing fire setting behaviors? Are there tools or methods that psychologists, clinicians can use or should use?
Unfortunately, not that many. It's just one of those things that just hasn't garnered as much research as, some of the, I guess, more high-profile crimes, violence, and sexual offending. So, for example, in terms of risk.
Is it a situation where fire setting is included in those violence risk assessment instruments?
There has been, some people have said that you can use violence risk assessment tools with people who have set fires. But I think that's more just for want of anything else, because it is an act of violence, or it can be an act of violence, but not necessarily. And it certainly has some quite specific characteristics that differentiate it from, a physical kind of hands-on act of violence. But yeah, some people have said you can use something like the HCR20 or, a violence risk assessment tool. There have been some specific risk assessment tools that have been developed, particularly for people with mental health problems who have set fires. That seems to be a place, if you're working in the mental health space, in forensic mental health, that you seem to come across more people who have set fires in that context. So it's that combination of the mental health plus the criminal behavior.
I wonder also, when we're talking about mental health, as maybe what happens with some of the fire setters who just have fire setting as their thing, maybe they will end up in the mental health situation or sector, I guess.
Yeah.
Were psychotic, or they were mentally ill at the time they were doing that.
Right. So they get diverted to the mental health. That's a good point. Yeah.
So so there are no specific tools that
So there's a couple, but they just haven't been particularly well researched. So there's one called the Safari. There's a reason why it's called that. It's not called, it's not after, going out and looking at animals, but it was developed in the UK. And that's a risk assessment tool for fire setters with mental health problems. And then there's a couple of other ones. I don't know. The other acronyms don't stick in my mind for some reason. But yeah, they're just not as well researched. So they're sort of there, but, you'd want to use something that had a bit more validity and reliability to it. That just hasn't really happened yet.
Yeah, okay. In terms of treatment approaches, I mean, what does treatment look like for someone who's a fire setter? If you're engaging with someone who has engaged in this kind of crime, what does effective treatment look like?
So myself and some Australian colleagues have developed a treatment program over here, and then actually around the same time as Teresa Gannon was working in the UK on her treatment program. And they're actually really similar, because they're both, kind of based on the literature on why people set fires. And so really, if you were focusing just on the fire setting behavior, you would want to address, their emotional regulation. A lot of the fire setting is to do with expressing emotion and not being able to manage their emotions effectively. You've also got, interpersonal skills deficits, social skills deficits. They're not very good at communicating. They're not very good at, interpersonal problem solving. They're not very assertive. They're again, research has shown that they're very under assertive generally as a group. And then you've got some sort of antisocial stuff. So kind of trying to address their antisocial thought patterns or their thought patterns around fire specifically. And then you've got, again, that as an area as well to intervene on is their attraction to fire and their tendency to perhaps minimize the harmfulness of fire or their belief that they can control fire.
Okay, it's interesting. So that out of the areas that you sort of highlight as being important to intervene with is emotional self-regulation, so managing emotions better, being able to perhaps recognize them, being able to sort of self-regulate, calm down, social skills deficits, so being able to engage people in their life, being able to form friendships and foster and sustain relationships that are fulfilling and meaningful.
Yeah.
Lacking assertiveness. That was one of the characteristics. Right. So it's almost and antisociality. So it's almost like the image one has of a firesetter is someone who's struggling with their emotional self-regulation, is introverted, withdrawn, lacks assertiveness.
Yeah.
And has perhaps a little bit of an antisocial mindset or bent to them as well.
Yeah, very much. Yeah, exactly. Yeah.
Is there an age type? I mean, does fire setting occur mainly for boys and for men and women equally, or is it older folks that occur, younger folks? I mean, I get a sense that it's young boys, I'm saying obviously, who would be the most likely to engage in fire setting behavior. Is that correct? Is that a
pretty much. Yeah, I mean, like as you know, most crime is much more committed by boys than girls or men than women. There are certain subtypes where the ratio is less predominant towards males. So that subgroup that I spoke about earlier on, the cry for help, the people who are, really quite unwell, perhaps psychologically, and wanting to get some attention for themselves or some help for themselves, they're still more likely to be men, but the ratio is a bit less heavily weighted towards men. And in terms of age profile, yes, it's more likely to be younger people. But you do occasionally get some middle-aged arsonists as well. Brendan Sokoluk, I think his name was a famous who was responsible for some of the Black Saturday bushfires down in Victoria back in 2009, 10, 11, that kind of time. And he was, I think, in his 40s, late 40s. So you do kind of get quite a broad age range.
What's his story? Do you know much about his story? Like, what?
Yeah, I mean, it was
these prototypes, these categories of fire setters.
Yeah, he would fit, I think, within that subtype where there's this fascination for fire because he had apparently tried to join the county fire authorities in Victoria and had been turned down. And on the day that he had, set the fires, he was apparently seen kind of sitting on the roof of his house, like watching the fires. He seemed to be kind of enjoying watching the fires. So that sort of being drawn and attracted to fire. You do get there's been other stories like that of people who have tried to join the fire service either as a paid or volunteer firefighter, and either been rejected or actually been retained, but then they kind of go off and set little fires. There was a guy that I worked with who would set fires and then call them in.
Right.
call them into the fire authorities. And he would kind of quite enjoy the fact that he knew how this fire had started. And, the guys would turn up, put the fire out, and they'd be, oh, I wonder how that started. Haven't had any lightning strikes lately, or any, like, going through the kind of obvious, how would this fire have started? And he would quite enjoy the fact that he knew how it had started,
Right. So he was able in knowing this information that he had started it.
Yeah.
And,
Yeah.
Do you have any cases that we can perhaps discuss that sort of exemplify a little bit of I guess, what a characteristic fire setter presents with, and how they might kind of engage in this behavior?
I could sort of talk about a couple of, try and sort of keep them a bit generic, but certainly an example that springs to mind is of quite a young fire setter who happened to be female. And I think she was about 15. She was one of the ones who was referred to our program when we were running a treatment program. And she had, that kind of classic, well, I say classic, but as I said, very adverse childhood, with, being reported to social services, and having been in a few foster placements, and having had sexual abuse. And her mother, I believe, was quite involved in the kind of drug trafficking or drug industry. So lots of kind of problems. And she had been setting fires from a really young age, and was eventually referred to juvenile justice for setting quite a big fire. And she was kind of one of our nice stories, in the sense that despite having had a very adverse, 15 years, she ended up responding really well to treatment, and ended up, the clinician who worked with her, sometimes I run into this clinician, and she mentions that she sometimes still hears from this young person. It's probably 3 or 4 years on, and she checks in with her sometimes just to let her know that she's doing really well and working. And she moved interstate. And, what that seemed to be about, like why that treatment seemed to have been successful, was that it addressed the function of the fire setting. So, looking at what that fire setting was about, which was very much that sort of cry for help profile, coupled with some quite antisocial, tendencies as well. But through developing a really strong therapeutic alliance, and to kind of use, schema languages, some reparenting, and some nice attachment work, this young person was able to move beyond that, and go on to have a reasonably normal life. So that's a nice example.
Sounds like a great example. Touching on schema therapy, obviously, because we are asked to talk a little bit about schema therapy, and I guess that one of the things that we're going to be doing with this aspect, or with our interview, is also trying to kind of think about schema therapy concepts, and to working with fire setters in terms of working with them in a clinical sense. I mean, I know you, Kate, have obviously done some schema therapy training. You're across these concepts and that, and where do you think that schema therapy is something that could be useful as a kind of modality to use with someone who might be a fire setter?
Yeah, I do. I mean, I love schema therapy, so I'm determined that it's useful in lots and lots of cases. And I think that one of the challenges in forensic psychology treatment work is that often people are working in prisons and places where there's an opportunity to work on the offence, the kind of criminogenic needs, the things that have led that person to committing that crime. But there isn't really an opportunity to work on the kind of deeper emotional, attachment-based injuries that the person might have experienced, unmet needs, and so on. But yeah, in terms of fire setting, I think that it would be really interesting, and I look forward to hearing you guys discussing this in terms of what modes could we identify. We were talking earlier about the 4 different types of fire setting, and there's, I can see parallels there with different kinds of modes. Like, the self-soothing mode, people who are really interested in fires and they seem to derive some kind of sensory stimulation from fires. That might be like a kind of a self-soothing kind of mode, a detached.
Do those clients report that they find it calming or soothing in the experience?
Yeah. And interestingly, I'm thinking about a guy that I worked with in Broadmoor who was a prolific serial fire setter, had set lots and lots of fires. And we kind of were asking him about his interest in fires and whether he enjoyed watching, movies with fires like Backdraft. That's a really old movie now, I'm showing my age. But anyway, or, did he like fire in general? And he said, no, I don't like fire in general. I just like my fires.
Wow. Okay.
So there was like an attachment to his own fires, but he did used to like watching them and feeling the warmth from them and so on. And another guy who was setting
I
fire.
wonder whether, just going back to that one,
Yes,
there was an aspect of almost, like I'm thinking, is this an experience of feeling powerful? Like I've created this. This is this. You could almost sense that someone might find that a very powerful and powerful kind of experience for them.
Yeah, absolutely. Yeah, that's right. And like speaking about finding it a powerful experience, people who aren't very socially confident or competent, and they can't communicate well, and they feel like life happens to them, and negative events happen to them, and they can't do anything about it, helpless. That sense of being able to overcome that through the power of fire. I'm not sure what schema mode that would be. I was thinking about self-aggrandizer, but that feels too much for this, because they're not
reveling in the sense of me or how powerful am I. I'm wondering, like, when they actually do it, whether the mode is like an impulsive child, angry, enraged kind of child mode, like screw the world, I'll show you kind of how it is, or I've had enough.
Yeah.
And I'm just so angry about things that how it comes out, and it feels like it is something about it that feels reassuring, perhaps.
Yeah, I think that's right. I think it's more child modes, and then I'm also thinking about lonely child modes as well, for those ones that don't have good social skills and feel really lonely and isolated. Rejected.
And obviously the fire setters that deliberately go out and do it because they enjoy it and they want to do it, and they want to target or get back at people. You think that they would maybe have a few overcompensating modes. Because I'm looking at like some of the treatments, the different sections that you actually work on, and I guess that I could sort of apply many of them to schema modes in one way or another. The lack of a certain assertiveness, certain kinds of schemas, perhaps emotional self-regulation ones, the vulnerable child modes, so some of that, and the antisociality stuff is obviously. That's, you think there would be some of the modes that we deal with when we're working with personality disorder clients, maybe who can be very much bully, attack, self-aggrandizer, and a bit of a
I do see some entitlement schemas, and not so much the kinds of entitlements that you would get with people with kind of more violent antisocial traits, but more kind of entitlements in terms of that sense of they know they think that they can control fire.
Okay.
They think that they know best, and that they have the power over fire. And there's a sort of lack of insight in terms of understanding that if they set a fire over here, even though they think it's under their control, fire can spread and can kind of end up causing, damage to property and harming animals and so on. They kind of not really thinking outside of themselves.
Yep. Okay. So that sense of creating fire and then believing that you can control it. So it's a big fire. It's not just a campfire, right? That's what, it's something bigger than that.
Like, I'm thinking about a guy that I worked with in the UK who would set fire to hay bales inside barns. And, he was quite kind of blasé about it, in the sense that he felt that was a pretty sort of contained fire, inside a barn. It wasn't anywhere near people. I don't think he was necessarily thinking about any animals that might be inside the barn at the time, but certainly he was, quite convinced it wasn't going to harm any people. But, when you think about how big a fire could be if you set fire to some hay bales inside a barn, it could very easily spread. Of course, the thing about England is it always rains. So they put themselves out. But just not thinking about what could happen, what realistically could happen.
Doing that kind of feels powerful for them there.
Yeah.
They felt like this was. What did he end up getting? So he got it wrong and then ended up burning down the barn. Is that kind of what happened?
I think the fire that he actually got charged with, he kind of progressed from the barn fires, and he was actually convicted of a different crime. He started breaking into women's homes and stealing their underwear, if I remember correctly. So that was what he ended up, and he was, he was psychotic. But so the barn fires or the arson wasn't what he was convicted for, but he was still a candidate for treatment for fire setting because he had this long history of having done that.
Okay. I know that we have a little bit of time left, so I just want to kind of ask you some questions, because it just made me think about the sexual stuff. There is a perception that there is a sexual element between fire setting and various kinds of paraphilias. Is that a myth, or is that something that that has been substantiated in the research?
I think that it probably comes from Freud's theories about why people set fires, because he had this theory that, and, as you know, all of Freud's theories involved sex in some way. So that may be where it came from. Plus, probably, anecdotally, there certainly have been cases of people who perhaps do have both of those kind of problematic behaviors, problematic sexual behavior and fire setting. But I think it probably comes from, I was saying that as juveniles, people who end up setting fires have got more problems and more intense problems. Yeah. And I guess when you have people with these kind of intense problems, social skills deficits, and, mental health problems, and, family history problems and school problems, you're probably going to end up with multiple problematic behaviors. And so that it's like a common ancestor kind of thing that then gives rise to fire setting over here, and perhaps some sexual deviance as well.
From that formulation, we would kind of consider fire setting to be a reflection of more serious psychosocial mental health, perhaps, problems in someone.
Yeah.
Okay. Kate, it's been lovely chatting to you today. What advice would you give to therapists, professionals involved or working with fire setters? What are there things that you would suggest to them, recommend to them?
And it's not really any different to how I would conceptualize any clients that you're working with, but it's, a good formulation, and it's a formulation that includes a functional analysis of the fire. So some of our kind of really good solid theories of fire setting emphasize.
Explain what a functional analysis is for our
Oh, sorry. Well, we were talking about like where does it come from and what's it directed at. So it's like, where did the idea to set a fire come from? What's the purpose of it? What is the person trying to achieve? And what do they get out of it? And what might be maintaining it? So how do they feel after they've set the fire? What did it change? What did the fire setting actually change for that person, right? So did it fulfill the function that it was intended to? And so, understanding what the act of fire setting was about, but also understanding that in the broader sense of where does it fit in with other problems that the person has in their life, social problems, mental health problems, psychological, psychosocial, so basically it's a holistic formulation. But generally, I'd say that, targeting those emotional regulation skills, social skills, and mental health problems is generally a good place to start working. Yeah.
Fantastic. If people want to get to understand a little bit more about fire setting, are there resources or readings that you could recommend, or suggestions that you could point people to go do that?
Yeah, there's a few books that have been written. A colleague and friend of mine, Rebecca Doley, has written a couple of books. One of which is written in quite an accessible way. So it's not necessarily an academic book. I can't remember the name right now, but if you Google Rebecca Doley, you'll find the title. And Teresa Gannon, I mentioned earlier as well, she's also written a couple of books that are more targeted at mental health professionals. And then there's lots of good readings, journal articles. Troy McEwen has written a few journal articles about fire setting. So I can certainly send you some.
We can put them on the profile here. So that would be great. So if you're listening, we'll attach them to the podcast notes.
Yeah, lovely.
All right. Kate,
thanks for having me.
Thank you very much. It's been lovely chatting to you. And I certainly feel like I know a little bit more about fire setting after being able to talk it through with you. And for our listeners, stay tuned for part 2 of fire setting. We'll talk through schema therapy and fire setting and how we would think about it and how we would integrate it and what we've learned from this podcast. So thank you very much.
Thanks.
Thanks, Kate.
If you're interested in learning more about schema therapy, join us in a hero's journey, the Schema Therapy Sessions at schematherapytrainingonline.com.